My name is Carmen. I'm here to perform a musculoskeletal exam. I have washed my hands and introduced myself to the patient. I have a 31-year-old male Caucasian. Can you tell me why you're here today?
Ankle pain.
With a chief complaint of ankle pain. When did you notice the ankle pain?
Yesterday.
Can you tell me, did it happen gradually or
Suddenly.
sudden onset? And where is the pain in the ankle?
On the left side, right here.
So you're pointing to the exact spot, good. And can you tell me how long you've had the pain?
About 24 hours.
Okay, can you describe the pain for me?
Kind of an achy, dull pain.
Is it constant?
Yeah.
Okay, and what makes the pain worse?
Walking around.
And what makes the pain better?
Staying off of it and ibuprofen.
Okay, and does the pain radiate?
No.
And did you notice the pain during an event or a tip? What were you doing when you noticed the pain?
Rolled it playing basketball.
Did you hear any noises?
And I heard a pop, yes.
And on a scale of 1 to 10, what would you rate the pain?
6.
And when you're walking on it?
9.
It's 9 out of 10. Okay. And do you take any medications?
Just ibuprofen.
And do you, how much ibuprofen?
Every 4 hours, about 600.
Do you always take ibuprofen or just because of the ankle pain?
Just because of the ankle.
And do you have any allergies?
Amoxicillin.
And can you tell me your medical history?
Stigmatism in my eye and wrist surgery.
Okay. And do you drink?
No.
Do you smoke?
No.
Do you use illicit drugs?
No.
Do you drink caffeine?
No.
What do you do for work?
Construction.
Do you exercise?
2 to 3 times playing basketball a week.
Would you consider that a hobby?
Yep.
What is your diet like?
A lot of protein, carbs, and vegetables.
Okay. And are you married?
Yes, with 1 kid.
Okay. And can you tell me about your family history?
Dad has high blood pressure. Mom has high cholesterol.
Any brothers or sisters?
No.
And any medical history with your daughter?
No.
Okay. Do you have any fever? Have you had a fever, weight loss?
No.
Weakness?
No.
Fatigue?
No.
Okay. The patient appears well nourished as well. Muscle, for the musculoskeletal, we know you have left ankle pain. What about left ankle weakness?
Yep.
Any bruising or swelling?
Yep.
And do you have any other joint pain?
No.
Do you have any neck pain or back pain?
No.
Any decreased range of motion in the ankle?
Yep.
And then, do you have any tingling or numbness anywhere?
No.
None in the ankle. Any headache or dizziness?
No.
Any fainting or syncope?
No.
Do you have any tremors or involuntary movement?
No.
Any problems remembering or?
No.
Okay. And then have you noticed any calf swelling?
No.
Peripheral vascular part of the Ross, and that is going to be any ever had history of blood clots?
No.
Anyone in the family had blood clots?
Mm-mm.
Any temperature changes or in your extremities?
No.
And then do you have any color changes in your extremities?
No.
Any for skin? Do you have any rashes or ulcers?
No.
Any itching?
No.
Any dryness?
No.
Your vitals are good. Heart rate 80, blood pressure 120/60, respiratory rate 20, temperature 98.6, and your oxygen pulse ox is 100%. So now we're going to move into the physical exam. We would listen to the heart and lungs real quick. We would listen for a minute. Deep breath. Patient is alert and oriented, ×4. When we're inspecting the ankles, we're inspecting bilateral for symmetry. We're noting swelling, bruising, calluses, deformities, and corns. For the sake of the video, I'm going to do the exam on the left ankle, but we would always start with the non-injured ankle and then move to the left ankle. So we start with inspection, like I just said, looking for all those things. We've inspected his gait and noted that he had a little bit of a limp when he walked in. We are going to then palpate the talio joint here. Again, looking for nodules, swelling, deformity, and it's normal. So then we're going to move on and palpate the Achilles tendon. Turn one way or the other. Right here, and palpate that. And then we're going to palpate the heel. Again, noting the same thing. Nodules, swelling, erythema. Here. Palpate the top of the foot. The metapharyngeals up here for pain. Sometimes pain in the toes or metapharyngeals can occur a fracture from a trauma such as a sports injury. Then we're going to palpate the tibia, distal tibia and fibula. So the fibula on this side, the head, the distal end, and then the tibia. Again, those structures can be injured in fractures, noting any deformities, nodules, and they're all normal. So then the next thing we're going to do is palpate the medial malleolus on this side, and it is normal. And then the deltoid ligament on this side, it is good. And we know that sprains can happen in the deltoid ligament, but they are less likely. So then we're going to, turn your body the other way, please. Palpate the lateral malleolus, noting again pain, deformity, swelling, nodules, crepitus. Then we're going to palpate the anterior talofibular ligament, then the calcaneofibular ligament, and the posterior talofibular ligament. And was there tenderness? Mm-hmm. There was tenderness along those ligaments, the 3 ligaments on the lateral side. So the next thing we're going to do is do some range of motion. So I'm going to have the patient lift up towards the ceiling, and that is the dorsiflexion. And we're testing range of motion here, and have the patient move the toes towards the floor, which is plantar flexion. Have the patient move the ankle M in towards inversion, and then outward is eversion. We're going to have the patient do that all against resistance, and we can note min, mod, resistance, and then plantar flex, and then again to the eversion, or inversion, and then eversion. Noting the resistance, which we could then grade. Now that we've done that, we're going to move into some special tests and do the anterior drawer test of the ankle. So this is where we're testing the anterior talofibular ligament, and we're testing for joint laxity. And we are, hold it here. Can we move this way a little bit more? Yeah. Okay, and we take it, and then we're going to move and do that. And we do this as much as the patient can tolerate. Is that hurt? And he reports some tenderness with that. Next, we're going to do the talo tilt test. So we are going to do the same type of motion, except for we're going to invert the ankle. So we're going to invert. Does that hurt? And that's testing
Yes.
for the calcaneofibular ligament joint. Or not joint, I'm sorry, ligament. So then after we've done that, we can move up and test the anterior tibiofibular ligament, which we would want to know for a high ankle sprain, and that we will use the squeeze test. And when we squeeze, we just squeeze mid-calf, and we're watching right here, and then does it hurt? Is that painful?
No.
Okay. And then from there, we're going to test look for bursa back here behind the Achilles tendon, and what we do is we palpate, and then we're going to do a force plantar flexion, and note any pain here. Does that hurt?
No.
And then after that, we are going to do an Achilles integrity test just to make sure that the Achilles, although we've palpated and we can feel, but we're going to test the integrity so that he's going to lie and prone. And then we, can you just relax? There we go. Squeeze, and we're looking for the pull-up of the Achilles tendon, which it does. And that my differentials are a lateral ankle sprain, and that's my number 1. My number 2 would be a medial ankle sprain, and my number 3 differential would be an ankle dislocation. And that is going to conclude the musculoskeletal exam. If I did not state I washed my hands, I did wash my hands.